I'm Dr. Todd Mahr. I'm a pediatric allergist at Gundersen Lutheran Medical Center in La Crosse, Wisconsin. I'm a clinical professor of pediatrics at the University of Wisconsin School of Medicine and Public Health. I'm medical advisor to the Food Allergy and Anaphylaxis Network. I sit on that medical advisory board. I'm on the National Assembly of the American Lung Association nationally, and I will be chair of the American Lung Association of Wisconsin for the next 2 years.
Okay. Let's talk about these new graphics that have come out on cigarettes. What do you think of them?
So the new graphic warnings that are proposed and now today are coming out are great, actually. There have been a number of studies that have looked at what patients feel when they smoke. A pack-a-day smoker will actually touch their cigarettes 7,000 times in a year. That means that you've got 7,000 contacts possibly to have them look at a warning. The problem is we've had the same warning in the United States on our cigarettes for 25 years. They're stale. Studies show that people don't even pay attention to them anymore. And that's one of the problems. Actually, in Canada, they did a study 5 years after they started warnings showing that people didn't even pay attention to them anymore. Yet we're dealing with warnings 25 years old. So what the studies are showing is graphically you need to have it larger, you need to have pictures, and you need to tell a different story and rotate them so they don't get stale. And that's part of what this new program will do. It'll go into effect September 2012, and the cigarettes will have different graphic warnings on them. All of them will have the 1-800-QUIT-NOW on it. So that's an added benefit. The added benefit is I'm a smoker, I look at this, and maybe it hits me that one time where I kind of go, oh, maybe I should give this out. I got a number. I got a number to call. All right, and that is great, and that number is good anywhere in the United States. It'll take them to the local American Lung Association quit line, so they'll have those resources available. So the graphic warnings, some people have said, wow, they're too graphic. Actually, you look internationally, there's some very graphic warnings in some countries that are quite disgusting, to put it bluntly. These are warnings that pictorially, a lot of people graphically like pictures. Some people can't read very well. The 1-800-QUIT-NOW, people are used to getting the information that way. But the graphics will show people with a tracheostomy, blowing smoke out of their hole that they got because of cancer. They show basically that cancer can kill. And they show a gentleman on a table having had basically an autopsy done and stitched back up. It's pretty graphic warnings. It shows a little baby, how the fact that if you're a pregnant mom and you're smoking, that baby will be affected by smoke. So all of those are good warnings, and I think the campaign will be to change them frequently. And that's what would be good. What we don't want to do is have it be stale also. If you have the same picture on there for the next 10 years, again, they're going to be stale and people will just come to accept that fact. So I think the graphic warnings are wonderful. You need to tie it in actually with a campaign educationally. And hopefully that'll occur. I know the American Lung Association is going to step to the plate. A number of other organizations will do the same thing. They'll step up and hopefully help an educational campaign to let people know, hey, here's what's new, here's what you're going to see on cigarettes. Oh, by the way, this is why you're going to see it. Cigarettes kill. Cigarettes will kill you. Okay, they're the leading cause of preventable and premature deaths in the United States. There's no question about that. The science is firm. So why not take that into consideration? Why not consider quitting?
Does this go far enough?
Well, I mean, some people would argue we should do more, and there's always kind of a balancing act. Obviously, we've been doing too little. On the other extreme would be to really go totally graphic. Well, that could offend some people, and I think this is not middle of the road. It's a little bit more. I'm very pleased with it. I'm very pleased with the fact they have a number of them that they've picked. It went out for public comment in November of 2011, and then now is cycled back. So they've had the public being able to comment on it. They've gotten some feedback. One of the feedbacks was put a 1-800 number on it to let people know they can quit. So that was excellent feedback to get back, and they've instituted that. I mean, ideally it would cover all of it, but it doesn't. It covers a majority of it, and it's right there. It's not on the side anymore. It's going to be right on the front of the cigarettes. So I think you could always say you should go further, but I think it's a happy median between going overboard and doing nothing.
As a pediatrician, do you feel like it hits your, does it hit teens and young adults, or is this demographic going to be hitting older folks? And what do you feel like as a pediatrician?
Yeah, I mean, looking at them, I think it's a good mix. I mean, they've got some in there that are going to definitely probably tug at the inner workings of an adult, but they've got a lot of them that teen and youth are going to see. Now you could say, well, they don't smoke anyway. Well, we all know they do, okay? And they look at things, and they're used to actually seeing graphics more. And I think having somebody, seeing somebody breathe through basically a tracheostomy and seeing smoke coming out and saying, this can cause cancer, it's a pretty good graphic, and maybe it'll help them get it. I think as a general provider, every day I see these patients who come in and the parents are wanting help so their kids can quit smoking, or the parents themselves want help because they've got a young family, a new child who's just been diagnosed with asthma, and they know, okay, I've been smoking outside, but now I really want to quit. This again will add one more point for a program for me to help them. Right? So many patients will try. It takes the average person anywhere from 5 to 7 times to quit smoking. Right? Well, having this reminder might help us so that when they do start smoking again, they look at that graphic reminder, okay, and they see that and they go, oh yeah, this is why I quit smoking. I'm not going to go back to it. So I think it covers the whole spectrum pretty well.
All right. We're out of time. Anything else you want to add?
I mean, I would just say that I think it's a great campaign. I think the American Lung Association, in cooperation with the FDA, has worked on this, given them the feedback. The 1-800-QUIT-NOW is a wonderful program to have available on every pack of cigarettes. And again, when you think about it, pack-a-day smoker, 7,000 times a year, they're going to see that package. It's pretty impactful. Thank you.